This is the coronavirus drive-through testing center at Bergen Community College in Paramus. When it first opened on March 20, they had to close early because demand was so high. They ran out of tests. They were scheduled to open 7 days a week. Now they open 4 days a week. When Darius News visited Thursday morning, May 13th, there were 3 cars in line. The multiple lanes set up when the National Guard arrived March 19 are empty. At 1:56 p.m. at the drive-through testing center at Fairleigh Dickinson University, set up for Teaneck residents, 2 cars arrived in about 30 minutes. Tell me about your experience for the testing.
Okay. It was easy. I just called my doctor. She gave me the referral this morning, and that's it. I went online, with the website. I just made the appointment, at 2 o'clock. Here I am, and everything was so easy, smooth. What happened was that I called my doctor because my legs, I feel tired, something like unusual. But I don't have any other symptoms,
Okay.
And by the way, she said, why don't you take the test? I said, hey, why not? And that's it.
So it was pretty simple to get the test. You did it all in one day.
Yeah, very, very simple. Easy, I would say, yes.
So when I hear a lot of times they ask questions of everybody, the president and everything, that tests are not available, yet you did it all in one day.
I did it all in one day. I didn't even know that it was going to be today that fast.
Darius News visited 7 testing centers 9 times on Wednesday, Thursday, and Friday between mid-morning and mid-afternoon. They are all in Hudson County and Bergen County, the 2 counties with the most coronavirus cases in New Jersey. They all mostly sat empty, nearly empty, or closed. Wednesday, March 13, 1:44 p.m. The Hudson Regional Hospital. Empty, no testing. Wednesday, 2:45 p.m. There was 1 car and 0 individuals at the Weehawken test site, which was set up in conjunction with Union City. It opened Monday, May 11. According to Weehawken town manager Giovanni Ahmad, the site can handle 400 to 500 tests per day, and about 200 to 230 people per day were tested. Ahmad said he expected more residents as word gets out. An emailed request for total testing numbers and results was not answered. On Thursday, March 14 at 11:01 a.m. back in Weehawken, 3 cars and about 6 individuals were waiting for tests. Then it was on to the aforementioned site at Bergen Community College in Paramus and Fairleigh Dickinson University in Teaneck. Then at 2:43 p.m. at the Rite Aid on Essex Street in Hackensack, the coronavirus drive-thru was empty. Friday, May 15, 1:20 p.m. Jersey City Drive-Thru Testing Center on Route 440, closed for the day. 1:38 p.m. at the Walk-Up Testing Center on Martin Luther King Jr. Drive, Jersey City. The doors are locked. No one answered the doorbell. 2:58 p.m. back at the Hudson Regional Hospital in Secaucus. 3 cars in line. Darius News requested testing numbers and results for this site via email and by phone. No numbers were provided. A request emailed Friday morning to the State Health Department for numerical information about all these sites was also not answered. Despite the apparent abundance of testing available in New Jersey, which is second in the nation with the most positive tests and second highest in deaths, this is how the week started at the White House when President Trump was questioned by the media.
Mr. President, you're now promising that everyone who needs a test will be able to get one at some point soon. Can you give us some figures on what you're changing to ramp up testing? When will that be a true statement exactly? And how exactly are you going to accomplish that?
And why hasn't testing gotten up to the point where every American who wants a test can get a test?
John, if I can follow up on that, your staff, your senior staff, as you just referenced, is able to get tested every day. When will it be that Americans across the country will be able to get tested every day as they go back to work?
The next day at the White House, Tuesday, more questions about testing availability.
President Trump yesterday said the U.S. had prevailed on testing, but today we heard from senators, both Democratic and Republican, who say that's not the case. Senator Lamar Alexander, a Republican, says what our country has done so far in testing is impressive, but not nearly enough. Senator Patty Murray, a Democrat, said we need dramatically more testing. It's unacceptable. We don't have a national strategic plan. What's the White House response?
Last week you said it would be nonsensical to test all Americans, and yesterday the administration celebrated testing 2.7% of the population. In order to reopen 100% of the country, what amount of testing does make sense to you? And what's an alternative to testing to track and contain the virus to make people feel confident to get back to normal?
Thank you, Kaylee. The president said on Monday that Florida has so much testing that testers are literally sitting around waiting for people and that there is a, quote, great overcapacity. Yet the reality in the state is there are still widespread criticism, reports of not enough testing. In the Kaiser Family Foundation ranks Florida 24th in the country per capita when it comes to testing. So is the president being overly optimistic about the situation in Florida?
According to the Centers for Disease Control, Florida has 44,811 coronavirus cases, while New Jersey has 145,089 cases. According to the U.S. Census, the population of Florida is more than 21 million, while New Jersey is approaching 8.9 million residents. Yesterday, I asked Governor Phil Murphy this question. The first one is based on questions that President Trump is asked on a daily basis multiple times. If somebody needs a test, can they get a test? But this is also based on me visiting multiple test sites over the last 3 days. And he's also been asked a few times, because the staff can get a test every day, when will everybody be able to get a test on a daily basis before getting back to work? Is that part of the plan here in New Jersey?
Yeah, I'm not sure you meant our staff. Our staff does not get tested. You mean the White House staff?
Asked that because the White House staff gets tests every day, why shouldn't Americans get tested on a daily basis before heading back to work?
I can't speak for the president or the White House. We've rolled out what is a pretty clear 20,000 tests per day by the end of this month, which is, by the way, basically 2 weeks from now. So that's where we're going to be. We've said 25,000 tests a day by the end of June. And we believe that is enough to address the tiers of our major concerns. Number one, vulnerable communities, most importantly, long-term care, but others. Secondly, frontline workers, healthcare workers, first responders, et cetera. And then thirdly, the general public. People have said to me, hey, by the way, your testing has gone down over the past couple of weeks. Testing capacity has gone up almost every day. Don't confuse demand with supply. I have this conversation with my family almost daily. There's a Rite Aid in Neptune, which is about 15 minutes from my house, which has capacity right now. If you want to go get a test, I don't want to send the whole state there, but that's a reality. The demand is down, and we've discussed this a lot. I mean, you've got infected people numbers down. Hospitalizations are down. It's an impact not just in the reality of the bug, or the virus rather, but also on human nature as well. So we have a testing plan in place that we are confident is sufficient, most importantly, to allow folks the confidence that they can come back and get engaged in society as we open it up. You want to know out there, folks, and I don't blame you, I want to know this too, that if there is a flare-up, we've got sufficient testing to spot it, that the return on that testing is rapid, that we then have contact tracing in place to figure out who you came in touch with, and we've got a plan to isolate you. So folks need to know that so that they can say, you know what, it's okay for us to get back and do the things that you're allowing us to do by reopening.
As for that Kaiser ranking, today they list Florida at 27th in tests per 1,000 residents. New Jersey is listed 7th as test centers stand empty, nearly empty, or closed. Reporting from Union City, Cesar Darius.